everybody. Welcome to the work session where we will be covering a lot of compensation and human resource issues. I am going to, well, first off, Jane Harrison is excused and on the road, and I believe Mayor Pro Tem Fort is walking in, making a grand entrance. So I'm going to turn it over to Charnel Jones, Human Resources, to present the first item.
Good afternoon, Mayor and City Council. We are here to provide an update on benefits and compensation for FY26. In today's agenda, we will cover total rewards. We will also provide an update for employee benefits. The classification and compensation study will give an update, employee compensation, and then talk about next steps. We understand and know that our employees are our greatest asset, and so it's important that we provide a competitive total rewards package that helps us to be able to attract and retain employees. So when we think about total rewards, it's just not pay and benefits, but it also includes our employee development, employee recognition, and also work-life balance. For today's purposes, we will be focusing on employee compensation, employee benefits, and also an aspect of employee development. So let's get started with employee benefits. Our medical benefits are our largest expense. If you include the city's portion as well as the employee portion, it is roughly over $58.7 million. And that's just for active employees. Our third-party claims administrator provides medical management services and pays our medical, dental, and pharmacy prescription claims. The city is self-funded, and so we are responsible for all claims up to that $375,000. Medical benefits, however, are on the rise and are expected to rise between 7 and 7.9% in 2025. But according to Understand Service and Innovate Insurance Services, which is USI, the city's broker, the city on average is trending below that by 0.9%. And this has contributed to the enhancements in our program design, our plan design, and also offering additional benefits and wellness offerings, which has been guided by our multi-year health and benefit strategy. So I introduced this last year, and so this was implemented back in the fall of 2022. And so if you look on here, this is our multi-year health benefit strategy. All of the check marks shows the things that we implemented thus far in FY25. We will also be launching a benefit survey this summer and also looking at doing a request for proposal for our broker. So for FY26 and 27, we will focus on continuing to look at our program design, how to enhance Plan A, also looking at our employee health center, reviewing our employee premiums, and also our wellness incentives. So our goals as part of the health benefit strategy is to make sure that we meet the diverse needs of our employees, that we align with best practices, and that we provide financially sustainable benefits. So for FY25, you can see all the things that we implemented. We enhanced our program designs for medical, dental, as well as wellness. We also added a host of benefits and incentives, such as leave. We added a part-time benefit 30 package. We added pet insurance, the North Carolina 529 savings plan. We also implemented the continuous service incentive, and we did a parking incentive as well for our downtown employees. Last year, there was no increase to employee premiums. So what are we proposing for FY26? For the 26 calendar year? There will be no changes in regards to our dental plan and our vision, but as always, we're continuing to look for ways to enhance Plan A to differentiate that from Plan B. We will also have no changes as it relates to our wellness assessment, annual wellness assessment. That will stay the same as the previous year. No premium increases for employees for medical, dental, or vision, or our voluntary benefits. We are proposing one plan change, which will be our tuition reimbursement assistance program. We are wanting to increase that reimbursement and also expand that to cover workshops and certification programs as well. As you know, that is a policy change, so that will have to go to Civil Service Commission, and then we'll bring the policy back to you for final review. So what we all been waiting for, classification and compensation study update. Our goal with this comprehensive classification and compensation study update has been to make sure that we have classifications that accurately reflect the work that our employees do, and that we also have pay structures that are competitive in the market to help us to be able to attract and retain employees. Back in 2024, we kicked off this comprehensive classification and compensation study, and we're almost, not quite, at the point of implementation for FY26, beginning to phase that in. So without further ado, I do have our consultants here today to give us an update on where we are with the classification and compensation study from Siegel, and I will bring up Patrick Bracken to kick that off.
Good afternoon. My name is Patrick Bracken. I'm a Senior Vice President with Siegel. For those that don't know, Siegel is a national human resources consulting firm. We've been privileged to be partnering with the city over the last about 14 months now on the comprehensive classification and compensation study. And my aim here today is to brief you on partly where we've been, what we found, and what the next steps are. For today's agenda, we have a couple items. First, we want to orient you to the overall project plan, then talk with you in a little more detail about the job classification structure, our market assessment methodology, which is the compensation study, the findings that come from that compensation analysis, the salary structure design and the guiding principles around those, and then close out with next steps. So this project in totality was multi-phased. We put together this graphic just to give you a sense of what the path has looked like over the last 14 months or so, but roughly speaking, at the beginning of the engagement, we were, in the spring of 2024, we were on site and meeting with Raleigh project team and stakeholders to scope out some of the key project parameters and also to kick off what we call the job description questionnaire process, the JDQ process. This was a process that was meant to solicit the feedback from employees directly as to the job functions they perform and help gain stronger insights into the current job classification structure that the city maintains and use the JDQ information to help reform or improve the way the classification structure operates and the way that jobs are both described as well as the knowledge and skills and abilities that are used to perform those. We then use that information to help us launch into the compensation market assessment phase. This entailed, and I have a couple more slides on this in detail, but a custom survey process that Siegel conducted, and then used that information to help inform our findings and recommendations on improvements or suggestions for improvements to the compensation structures that the city currently maintains. So a little bit more on the job classification structure process. As I mentioned earlier, employees were invited to participate in the process. Because of the size of the project and the efficiencies associated with the JDQs, what were called job ambassadors or JDQ ambassadors were identified through a collaborative process with human resources as well as department leadership. Pleased to report that about 95% of the JDQs were completed, which is a very strong response rate. And really gave us a good foundation from employees directly as to what is required for their jobs and helped us determine what job functions were appropriate and currently described and which opportunities existed for either refinements or improvements to the classification structure. Overall, our current classification analysis suggested that The city would benefit from an expansion of the number of classifications it currently has, which is approximately 350 to about 485 job classifications. And the primary goal of the expansion of these is to help better define and more accurately define the types and level of work that are actually being performed by employees. It also better aligns with what we would typically see in terms of a total number of classifications for an employer of this size. Additionally, we identified what we call job families. There are 37 of these that we helped work in conjunction with the Human Resources Department. These job families are really helpful for organizations to be able to group similarly situated jobs, and it can be a useful grouping mechanism for employers. Once we concluded the classification analysis, we then moved on to the compensation study portion, which entailed 5 primary steps. The first step is what we call identification of the benchmark jobs and the comparable peer employers. The identification of the benchmark jobs is an important point, and I have a slide on this next, so I won't spend too much time on this slide on it. But in conjunction with that, as well as identifying where Raleigh employees are both recruited from and where Raleigh loses employees to, helps serve some of the foundation for the identification of which peers would be surveyed as part of our custom survey process. Once we had those parameters nailed down, we then worked with the city to design a custom survey document that then we, Siegel, distributed to the peer employers. And we used that information from the peer employers to help inform the market comparisons. Once we had that data in hand, that gave us a sense of how competitive or non-competitive the current pay structures are for the city, and that helped inform our options for recommendation development. A little bit more on the selection of benchmark jobs. When an organization does a compensation study, especially for an organization of this size, it's not practical or feasible to survey every single job classification. So what is considered or called benchmark jobs are identified. There's a process that governs the benchmark identification process, and we tried to provide a graphic here to help you all understand what framework we apply to this. But the overall goal here is representativeness. So with the 101 benchmark jobs that were identified, and there was feedback both from the various working groups here at Raleigh, as well as departmental leadership on those classifications, the goal is that those 101 benchmark jobs can be used as a representative sample to infer to the entire workforce at large. So a couple of the key parameters are, one, we want to make sure that the benchmark jobs are reflective of the workforce composition. So when we think about that, we think about things like titling groups. So for example, analyst, specialist, assistant manager, et cetera. That we want to make sure that we're capturing the broad array of job families. So these are things like administrative support, public safety, operations, legal, et cetera. We want to also make sure that our benchmark jobs are statistically representative of the overall workforce. And we also lastly want to make sure that for the benchmark jobs that we're picking jobs that we think are likely to be found at the other peer employers. So said another way, we don't want to pick an overly specific job that's either a hybrid position or a uniquely defined position at Raleigh if we don't think that that job is going to be similarly found among a peer employer. I mentioned the peer agencies or peer employers. This is a list of the comparator organizations. Contractually, we were agreed to up to 12 organizations. You can see that we have organizations here, both from the state of North Carolina as well as outside of. We were pleased to report that of the 12 peer employers, only one, the town of Apex, declined to participate. The other ones they're color-coded in such a way that black meant that the peer employer did not participate directly, but pointed us to source information, either directly provided that to us or information that they have readily available for Siegel then to data mine and complete on their behalf. The green are survey responses that we received directly from the peer employers. Once we receive this information, we work with them very closely to validate and clean their information. This includes various round robins of emails and phone calls with them to clarify information, clarify job match information, or anything else that we needed to ensure that the data was of the highest quality. We have a slide here on what we call external comparisons, and this is part educational and part practical in terms of some of the other data elements that we used. First, just wanted to comment a little bit on what we call the job match process. Whenever conducting a compensation study, it's really important that you, as in an effort to get an apples-to-apples comparison, you not just focus on job title comparisons, meaning a benchmark job at Raleigh and that corresponding job title, to not just look for that job title at a peer employer, because job titles can sometimes be misleading or not tell the whole picture. So as part of our process, we, in conjunction with the job title, also develop what we call job summaries. These are 3 to 4 sentence paragraphs that also include minimum job requirements in terms of education and experience. And we use that to determine whether or not there is a comparable job at a peer employer. You'll notice in the text here that Siegel uses a 75% rule. What we mean by that is that it's very uncommon to find a job that is 100% identical between organizations. So what we focus on is that if at least there's a 75% overlap in terms of duties and responsibilities, we consider that worthy for consideration as a job match. It doesn't necessarily mean that it will make the final cut, but as a starting point, we draw that as a minimum floor. And then we work with an organization to, if we need to, drill down and ensure that we have a fuller understanding of the position before we then finalize that as a job match or determine that it's not a comparable job match. The second piece of information on the slide here relates to the published survey data. You'll see a table on the next page that talks about this data cut. And what this is meant to represent is private sector information. You might ask why can't Siegel survey private sector employers directly? We've tried, but in the practicality of things, they will not participate usually in a compensation survey, especially for a governmental employer where their information could be subject to FOIA or releasable in any way. So what they do is participate in large survey exercises, and those firms conduct those usually nationwide surveys and then can anonymize their responses. Siegel purchases licenses to access 3 of the largest firms that are out there that do that work. They're listed here: Economic Research Institute, PayFactors, and Comp Analyst. And this information was referenced as part of our study to represent private sector compensation levels. And then lastly, just as a technical note, you'll have noticed on the previous slide where I highlighted the peer employers. Some of those peers were located out of state, and where we do have out-of-state employers, Siegel adjusts for geographic differences in the cost of labor. We have an economic and econometric tool that we also purchase a license to that enables us to make geographic differences between varying regions, and that helps us normalize, again, that apples-to-apples concept when doing compensation benchmarking. So with regard to some findings, this is the first table you'll see with some data on the comparison of Raleigh's compensation structures to the market average. Just for education purposes, I'll take the first row of the table just to explain the math behind that, because then that rubric applies for the next couple slides when you see compensation data. So when we talk about first, the custom survey data sources, that is the peer employer list that we saw, the 11, I guess, excluding Apex, public sector peer employers that we surveyed. Then when you trace that row across, you'll see at the top, we call base pay range midpoint. This is the published pay range for the benchmark jobs, meaning the published minimum, midpoint, and maximum associated with that position. So just as a point of clarity, these are not actual salaries. These are the pay ranges that are associated with the benchmark jobs. And then the ratios or the percentages that you see on the row, that is the city of Raleigh's pay range minimum, midpoint, and maximum compared to the market average. So to take the example of the top left, what is that, square, I guess, the 85%, what that means is that at the pay range minimum, For the benchmark jobs compared to the custom survey data sources, Raleigh's pay range minimums are 85% of the market average pay range minimums. Similarly, taking that same logic and extending it across the row, at the midpoint, Raleigh's pay range midpoints are 89% of the market average, and at the maximum, 93% of the market average. Working one row down at the published data source level, this is the private sector data sources. It's the same math, meaning Raleigh's pay ranges compared to the respective market segment. So in this case, is Raleigh compared to the private sector, 92% at the minimum, 97% at the midpoint, 98% at the maximum. And then taking a blend of those two markets, which is Siegel's methodological approach, which is the overall market average, you can see that across the entire pay range, meaning the minimum, midpoint, maximum, Raleigh's pay range minimums are 86% of the market average minimum, 91% of the market average midpoint, and 93% of the market average maximum. And then the last point to make on the color coding is that anything that is in red is below market. Siegel's definition of below market is below 95% of the market average. Anything that's between 95 and 105% of the market average is in the market competitive corridor, so that would be considered market competitive. And anything over 105% is denoted in blue and is above market. So with that understanding with us on how Siegel reports compensation data findings, we then drill down to the same data, but now arrayed by the peer organizations. So what this table is attempting to show is Raleigh compared to the respective peers, and it's the same ratio math, meaning that the percentages you see are Raleigh as a percent of the market averages. And you can see here that, again, in red, it would be below market, black is at market, and blue is above market. And it almost doesn't matter which peer you look at, but you can see that there's a fairly resounding below market finding regardless of which peer you look at. To talk a little bit more about the market data findings, we also did some analytics around what we call pay range width. The pay range width is the distance from the pay range minimum to the pay range maximum in a percentage calculation. What we found here is that when we looked at the benchmark jobs, the city of Raleigh's average pay range width is 70%. So that means 70% wide from minimum to maximum. And when we look at the market data is suggesting a 57% market range width. This in and of itself isn't necessarily a problem, except that it just helps us understand how the current structures are designed and if there was any opportunities for either alignment with best practices on pay range width or in consultation with the city on the suggested revisions to the current compensation structures, just keeping in mind the current range width and if there were opportunities for us to address that or fine-tune that in our revised structures. With regard to salary structure design, this is a phase that we are currently in with the city. But for today's purposes, we wanted to provide you with some of the guiding principles that have been governing our work. Firstly, we wanted to ensure that all of the pay grades and the pay ranges that we are establishing are both internally equitable as well as externally competitive. That's really important for a lot of organizations because you want to ensure that your pay structures are in line with market conditions and that they are adequately designed such that you have effective recruiting and retention strategies, but that also internally equitable suggests that there is an internal hierarchy that makes sense for the organization and that correctly and appropriately identifies the internal worth of jobs to an organization. Having these principles in place can help for both a career progression, so explaining to the workforce the logic behind how a pay structure is set up and how it operates. It can also ensure that there is an appropriate distance between supervisors and subordinates to prevent or alleviate pay compression. And lastly, as I said before, it can also help with external competitiveness. Another principle that we wanted to make sure to keep an eye on was that the administration of the pay plan was as easy as possible. So this meant sort of using the KISS principle, the keep it simple principle, because we wanted to make sure that we can explain the pay structure to staff and that managers in day-to-day operation of the organization can also explain it to their team members. And then lastly, it was important for Raleigh to have any work on the salary structure also align with the total compensation philosophy statement that it's been working very, very diligently on. And this statement document identifies things such as the labor market and market target pay administration principles. So to close out with next steps, as I mentioned, we're in the process of finalizing the proposed salary structures with the City of Raleigh's project team. Siegel and the city will be continuing to review those analyses as well as developing some cost implementation scenarios for the city's review and analysis. And then we also are working on, we identified some jobs where FLSA, this is the Fair Labor Standards Act, exempt, non-exempt designations, where we think the city might want to consider some changes there. So we are working that through right now. And lastly, Siegel is in the process of drafting job descriptions for all of the 485 newly, well, in some cases newly, but in other cases existing proposed classification titles.
So let's get into employee compensation.
Before you move, can I ask a quick question? Sure. May I ask a quick question before you move? When do you anticipate having a final report? Oh, is that what you're going to say? Okay, my bad.
I know we're anxious. But let's get into employee compensation. But before we do, for FY26, let's talk about FY25, all the things that we implemented. So for public safety, we did market adjustments for FY25. The annual pay increase and the public safety education incentive was roughly around $11.1 million. For all other employees, the market adjustment, the annual pay increases was around roughly $12 million. Our incentives that we implemented was the award for service and the new continuous service incentive, which was around $3.5 million. And so to date, we have implemented over $26.6 million of investment in our workforce. So under consideration for FY26, you heard the consultant say that on average, our pay salaries are below market. And so our salary range minimums are below, on average, 14%. Our midpoint is below 9% on average, and our maximum of our salary ranges are below, on average, 7%. So based on that information, we know that our salary structures will be adjusted. So for implementation strategies, we know that we will have to bring employees up to the minimum. We will also have to consider market adjustments, as well whether or not annual pay increases, how we go about that process. So putting all of that in perspective, we know a 1% increase is roughly around $3.75 million for all employees. 5% is $18.75 million for all full-time employees. That goes up to 15%, $56.25 million. And so if we think about, on average, of us being between 9% and 14% below average, that is roughly around $33.76 million to $52.5 million that we all have to think about our approach to that. And that's not including any other benefit changes. So from the previous slide, we will be analyzing all of the feedback that Siegel will bring forward to us from the data from the class and comp study and also implementation approaches, as well as our annual pay increase. And so we will be bringing back in April and May recommendations to council as part of the budget process. So next steps is to review our final results from the consultant and the implementation approach for the classification and compensation study. We will also meet and review that approach with our designated stakeholders, and we will return in April, council meeting, with final results. And the one last note is that I do want to bring forward, because I am very glad and about my talent acquisition team of us really working hard with departments on recruitment strategies to decrease our vacancy rate. And as you can see, back in March of 2022, we were around 14.9%, and that includes full-time and part-time employees. And as of March the 7th, we were at 10.7%. So I just want to say thank you to my talent acquisition team, also my classification and compensation team for all the hard work they've done so far with things, also our benefits and wellness. Really, I'm just proud of my whole darn team, I'll tell you, for all of the work that they've done and really bringing forward programs and really helping to make it better for the city and for our employees. So now we'll go to questions that you may have.
Questions? Counselor Jones?
I'll start off with the vacancy rate. Can you bring that slide back up? And first, thank you. Thank you so much for your work on this. I would like to I'd like some clarification, because I know especially within the last year, we've been talking about vacancy rates a lot, and it's dropped a lot, so congratulations, that's phenomenal. How many of that was removing extended vacancies? How much percentage-wise was that of just eliminating long-term vacancies?
As of today, we have not permanently eliminated any long-term vacancies as of yet. I know they're going through that process with the budget process, but that has not been finalized. I think that will come forward with the budget process, the positions.
So then confirming that this is hiring the staff to fill those vacancies, that's what this number is reflecting?
This number reflects, based on all of our full-time and part-time, permanent part-time positions that we have that are currently budgeted and that are our actual classifications, and the vacancies that we have, that's taken that. We only have, I have that with me. My notes, because I knew I would get asked about it. Roughly around 456 vacancies, full-time, and 36 permanent part-time vacancies.
Can you tell me at the highest point, at that 15.1%, how many vacancies that was?
I can't tell you that, but I can get that data back to you. I can give you the breakdown for each of the years if you're looking for it.
Yes, please.
Okay.
And then another question that I had was, I know that we had referenced a former compensation study that we'd done a while ago. Did we, in the past, take any of those recommendations? I don't remember if we actually went with that study. I think it was back in 2017. And then what recommendations did we follow or not?
I was here back in 2017 when we went through that process, and we did have a phased approach to that process in regards to implementation, and that was implemented, I want to say, in 2018.
So you did implement some of the recommendations from that study?
Correct, yes, from that study, yes. But it was a phased approach because we were not able to do all of it at one time.
Okay. All right.
So it was implemented in 2 years, 2018 and 2019, and the reason being there had not been a comprehensive study in 13 years. And so we led with getting folks to the minimum public safety, and then the next year we phased in the other components of it.
I'm sorry, just on this point, real quick, if I may. Did we also back out some of those changes as far as I remember the step process?
Oh, yeah, we reconfigured for public safety. They wanted steps to be able to see what the degree of certainty of what each step in the progression of their employment would look like. However, after a couple of years in those steps, there was a request to change to open ranges.
Thank you. You done? Okay, Counselor Silver.
Almost a question for you, Chanel or Patrick. When you look at the salary survey and compare it to other jurisdictions, how is benefits weighed? Because I'm assuming that this salary and benefits is the complete package. Was this just salary, or there's any weight toward the benefits? Because I can imagine it varies from jurisdiction to jurisdiction.
This was purely salary.
Okay. And as part of salary surveys, are the benefits part of that, or it's something separate? I'm just trying to understand, I know it's comparing apples and oranges, but, certain positions have benefits that make, there's a trade-off in terms of someone considering a job. It's both salary but also benefits. So I'm just trying to understand how that is factored in.
It's a great question. So in this survey, Chanel said it was just base pay comparisons. There are methodologies out there that do total compensation studies that typically will look at base pay, look at health premium, generally from the employer contribution perspective, as well as retirement contributions, and then oftentimes include paid leave comparisons as well.
Go ahead.
Hi, this one's going to be for Charnel, I think, or the manager. In last year's budget, we did the penny for pay study. That was one of the things we included in last year's budget. So that was like 11, or I see like signaling to Sadia, maybe it's a question for Sadia. So that was like $11 million. So we've kind of got a buffer built in. So does that mean we have $22 million? We have last year's 11.8 and this year's upcoming 11.8, or?
So you do. So good afternoon, Sadia Sitar from Budget and Management Services. So remember that the general fund at the end of the year, everything goes into one pot, and that's where we combine everything together. And at the end of the year, you see what are called capital reserves. So you don't have anything from last year, you have this year. So essentially, as I said in the City Council retreat, you have merits built into our base, which is around 9-ish million, and then you have the 11.4 million, which is the penny for class and compensation. Yes, so we're looking at just 20-ish, 21-ish million dollars right there.
Okay, so
Yes.
in this range that we were just quoted, this like 33 to 52
Yes.
million, we have about
We have about 20-ish.
20-ish.
Yes, ma'am.
Okay.
But that's, to be clear, that's if we don't do merit increases. So we have
Absolutely.
only the penny that we committed to implementation for the comp study. So don't get confused and think that there is a bucket of 20 million. We've got the 9 that would cover the traditional merit increases that we do every year.
Got it.
Okay, I have a couple of questions. One, this, to state the obvious, is a big number.
Absolutely.
And I know you were saying 13 years ago, and then we did this other salary study 6 years ago. So one of the themes I've heard a lot, just even since being elected about 3 months ago, is this trying to smooth so that we don't have these convulsive, right, sort of surprises of you need to invest 50 million suddenly because your pay has gotten behind. So just could you speak a little bit to that about getting here, knowing we've come through COVID and a high inflationary environment, but is the thought that we're going to try to do much more frequent salary studies, although and it was a very good explanation of a lot of work from Siegel. So clearly, even the study took 18 months. But is the idea to try and avert these sorts of cataclysmic, requests for money by doing more frequent studies?
Yes, and we will have to also make sure that we maintain the salary structures that we have. And that requires us to continue to look at doing market adjustments and adjusting our ranges as appropriate, where that has not necessarily been the case in the past. And so our approach to maintaining the system has to be different in order for us to continue to be competitive in the market.
Yep. And then this is just more of a minor technical point, but it was a little counterintuitive intuitive that we compared less favorably to public sector comps than private sector.
Yeah, that's a good point. That does jump out. I can go back to that slide if you'd like. But the idea there is, and it does vary depending on the region of the country that you're looking at, but I think there's a popular perception that pay in the public sector always lags pay in the private sector, and it's not always the case. And the data we're seeing here, at the minimums, Raleigh is definitely still below, but at the midpoints and the maximums, again, not 100%, but within that market competitive corridor. To the point that was made earlier about the benefits, that I think is something that is worthy just potentially further consideration, because in the private sector, the benefit structures are typically pretty different than what they are in the public sector.
All right, thank you. other questions?
Did you want to add? Okay.
Okay, great. Thank you. All right, thank you for all the work on the study. All right, we have a second item on the agenda, and we have Allison Bradshaw to discuss the separation allowance study that was done.
Yeah, so good afternoon, Mayor and Council. Allison Bradshaw with the Finance Department. I was before Council last summer with a timeline to complete an actuarial analysis and report specific to the cost of a separation allowance for the fire and emergency communication departments and several operating departments, including Parks and Recreation, Transportation, Raleigh Water, and Engineering. The process started with the request for proposals, which was reviewed by staff from the Finance Department, Human Resources Department, and the City Manager's Office. Boomershine Consulting Group, or BCG, was selected as the actuarial firm, and after the contract award, staff from the city provided the demographic information necessary for BCG to complete the actuarial analysis. Today, I'm joined with Greg Stump, the Chief Actuary and Vice President of BCG, is with us today. And by way of introduction, Mr. Stump is an experienced actuary specializing in public sector plans and holds several certifications in his field and is a member of the American Academy of Actuaries. And with that, I will turn the presentation over to Mr. Stump.
Thank you. So a couple things I want to start with. Number one, we're going to talk about this benefit package, costs, and other details. I'm not an advocate for or against it. Completely neutral. This is an independent analysis. So my two reasons for being here are, one, so you all understand, if you're going to adopt such a plan, that you know what the costs and risks are. And number two, to answer any questions that you have that will help you make a better decision. So, and you can ask the question whenever you want. You can wait till the end or while we're going over this, but I want to make sure I answer everything as best as I can. So we'll talk about the project background and the benefits and a little tutorial on pension funding background to help put it all in perspective. Summary of the demographics and the analysis for all the groups that Allison just mentioned were split into two studies. So one is fire and emergency communications, that we'll go over all those results separately, and the other one is the 5 select operating departments that were just mentioned. We'll also look at potential funding outlook should a plan be adopted, and with some conclusions. So the project background is this: separation allowance, we'll call SA. It is required by state law for law enforcement, which you know. It's not required for other employee groups, but the city staff have been requested to look into it. For the groups that we just mentioned. It provides a temporary benefit from retirement to age 62. If you retire after 62, there is nothing. And the benefit formula is very simple: 0.85% times number of years of service times the final pay, whatever your last pay is. Let's see, I think Allison went over a lot of this. I'll start with the second bullet point. We collected data as of October 1, 24. And that was not chosen arbitrarily. We wanted to make sure that we got all the pay increases we just talked about that were put into effect in September. And the eligibility this was modeled after is consistent with the state program, local government program. So there's two eligibility criterion for the full benefit: age 60 with 25 years of service, or 30 years of service at any age. And that's important when you try to put some of the results into perspective for the different groups, and we'll go over that. It's also importantly that third sub-bullet there, the service for eligibility includes unused sick leave, which we have data on, prior service from other North Carolina local governments, and prior military service. So all the assumptions were developed by us, and we worked with the team here at the city, decided the most reasonable and consistent approach. So here's the funding background. I don't know if you can, I can't quite see on my screen. There is a number line, very light blue, pointing to the right. So this is the way pension funding works for any pension funding program. The state program, what we're talking about today, retiree healthcare, anything. So it's funded over the course of someone's career. So when someone is hired, you're not expected to have any assets for them, because they haven't accrued any benefit yet. However, the actuary can come up with an annual cost. In this example, it's $3,000. So the city's going to start putting away $3,000 a year until the person retires, and then they will have, look to the right side, $200,000 in this example. And these are reasonable numbers for this benefit package. At any point during the middle of someone's career, whether it's 2 years in, 5 years in, et cetera, you have that annual cost, which is going to increase because everything's determined as a percentage of pay. Pay increases, the cost increases. But the asset target kind of goes from 0 to 200,000 over the course of that time. So if you take all the populations, the two different populations we looked at here, and just plot every employee on this number line, it fills the whole thing. You have some people with very little service. You have some people with 30 plus years of service. So they're all throughout there. So every individual has what we call at the bottom of the screen there, normal cost, which is the annual cost, and an actuarial accrued liability, which is the assets needed. Those are just the technical actuarial terms. That's what you'll see in actuarial reports. Same picture, next slide. The only thing we added here was that red box to point out that the actual assets of any potential plan are 0, because we don't have a plan yet. So all those people that are not on the green part of the number line, you start out with an immediate shortfall. For people that are going to retire next year, you have a larger shortfall. For people that have 5 to 10 years of service, you have some degree of shortfall. So that's where all these numbers are going to come from that we're going to go over here. So summary of the analysis, I'm just going to show a snapshot of some of the demographics for this group, the actuarial costs, the projected funding over a course of 20 years, and then we'll go to the other group with the five operating departments and do the same thing. So we split this group into fire and emergency communications, and as of the snapshot date, right, so this is all as of October 1, it's the number of employees, average age, average salary, average years of service. That gives you an idea of who we're dealing with here. And one important thing to keep in mind here is that, and especially when we come to the operating departments, fire has more service and younger than the other groups, not the emergency communications, but the operating departments. So that will explain why when we get to the numbers that their cost is higher per person. So here are the actuarial figures. We talked about accrued liability. We talked about normal cost. So the new term there is present value of benefits. So the present value of benefits is just taking everyone on that number line that goes from the green to the yellow to the red and just go all the way to the end. All right, we need 200,000 for everybody because they're going to eventually earn that. That's the total present value. The accrued liability is just based on whatever they've accrued to date, whatever point they are in that number line. So for some people, it's a couple years, some people it's 10, 15, 20 years. So it's always a subset of the present value. And you can think of it this way, it's roughly halfway. So if you took all those employees in that first group, fire and emergency communications, they're roughly halfway through their career on average. The unfunded amount is the same, having no assets. And the normal cost, that's the $3,000 for the new employee plus the $4,000 for someone 10 years in, plus whatever number it is for everybody else, put all that together and it's about $2.1 million. And as a percentage of payroll, that's about 4.2%. That's an important number to keep in mind because that's the cost of the benefit. The actual cost, like the contribution to a fund, would be much higher than that because you have the cost of the benefit for everybody on that number line plus the cost of all the shortfalls. And that's what we're going to look at next. So the total contribution for year one would be about 9.6% of payroll, or about $5 million. As we said, the 4.2% is the cost of the benefits. The rest of it, the 5.4%, is just a payment towards the shortfall. And we used an amortization period of 20 years. So that means that all those shortfalls would be completely paid off at the end of a 20-year period. And then the cost would just drop down to the normal cost, which is the blue there. However, keep this in mind, and for everything I've gone over so far and will go over, everything's an estimate, everything's based on assumptions, these are all future events. So we're always dealing with a moving target. So you can't hang your hat on any one single number, but these are best estimates. Yes.
I'm just going to ask you a really quick question. On the last slide, can you tell me the difference between the 2.1 million, the normal cost end of year, and the 5 million that's on that next slide? I'm a little bit confused.
Okay, yeah, good question. So The blue section there is the 2.1 million, and the red section is the amortization payment. So it's a portion of the 33.2. And that portion ends up being, around, what is it, 2.8, 2.9 million. So that's what the red section is. So it's paying for these shortfalls. It's the 50,000 plus, you have people that could retire next year, their liability is going to be higher. It's paying a portion of that, such that at the end of 20 years, it's all fully funded.
Right, and so it has both. It has the people who could retire, but it also has the people who are just starting.
Yes.
Okay,
Yep. And except for the brand new hires, there is no shortfall there.
got it. Thank you.
And we have another question.
I have a question
from-
too, sorry. You said to ask as you're going, so I figured I'd just ask now.
Yeah.
You mentioned assumptions. What assumptions did you use when you came up with these figures?
There is a full report that goes along with this, but I'll give you the key assumptions. 5.5% investment earnings, or also known as discount rate. 5% salary increases per year. We use the standard mortality table, but to be honest with you, mortality is not a big factor for this plan because the benefit stops at age 62. The mortality rates for people younger than 62 are very, very low.
Meaning you didn't assume that anyone would pass away before they could.
No, we
finish it.
use the standard table. It's just that the percentage, the probability of dying in those
Okay.
early years is just very, very low.
And then the other question I had real quick is if I just wanted to get the fire numbers out of this, it's 550 fire employees, 104 employees, so that's 654, and 550 of 654, based on my quick math, is 84%. So just the fire numbers would be 84% of these totals, or am I doing that wrong?
That's a good start, but I can tell you that it's going to be higher than 84%, because if you look at this slide, the average age is 39 and the average service is 13 years. So they're closer to being able to retire. And by the way, we did not run it separately.
You don't have any data just for fire?
We had the data, we just didn't run it separately. So when we run these calculations, there's a software package where you feed in all the data, your assumptions, and it gives you the results. We could do it separately, we would just have to split the data up. But I can tell you that it'll be higher than whatever the head count proportion is.
Okay, thanks.
Just because there's more service. So the last part for the fire and emergency communications is just taking this and expanding it to, all right, well, not just one valuation date, but what would it look like going forward? Well, as we pointed out with that number line, everything's measured as a percentage of payroll. So naturally, the costs are going to increase over time in nominal dollars. Percentage of payroll, I'd say, is pretty close to the same, give or take, actual experience. So the funding and projections just goes over, all right, how do we expect the fund to grow? And this is a little bit of a busy slide, but it explains how we would go from the 33 million, that's the first purple bar, none of which would be funded initially, to being fully funded. Now, of course, over time, that 33 million is going to grow and grow and grow because you have, it's getting closer to the total present value, which was 60 some for the group now, plus you have new hires coming in. And so the size of the fund just grows over time. So we would expect, and again, just an estimate, best estimate, that this fund would be 92 million at the end of the 20 years, but would also be 100% funded. So you stick to that 20-year amortization plan, it's fully funded. And the funding ratios are shown with the dots there. You start at 0, you get to 100. That's also the way that funding works. So as I pointed out with the number line, that's how it works for every plan. This is how it works in terms of funding projections. You're always working towards 100%.
So just another question on that. When you look at our law enforcement, we're not fully funded or even close.
Well, that's true. And we did review that just to try to maintain consistency with it where we could. And whatever the funding ratio is of 20 or 30%, it was something relatively low. Might have been higher than that. It's expected to be fully funded in 14 years. That's what I gathered just from reading the report. So in other words, they started at 20, just like this, but they have 14 left.
And then is this assuming that every firefighter from now stays with the city through the ability, it doesn't account for those who, we have a high turnover rate, and as soon as somebody leaves the department, then we gain money at that point?
Yeah, there will be a gain. And so yes, this assumes everybody's going to get the benefit. However, there's a thing called an experience study. This is going a little off script here, but if you establish a plan every 5 years or so, the actuary, whether it's our firm or some other firm, would do an experience study and look at those things. Okay, now that you have this plan, what was the turnover rate over those 5 years? What age are people actually retiring at? Other factors. But
So then assuming, since we do it for police, we would have, not you, because I know that you're not there, but in theory, since police has 14 years, we should have those numbers of what that turnover rate is for police and how much we've saved. And that's what you're saying, that,
yeah, and again, it's a moving target, so every time there's a valuation done, it's kind of self-correcting in some ways. If you had a large number of people leave or a very large pay increase, the next time evaluation's done, it's going to catch that in the form of what actuaries call a gain or a loss.
okay, thank you.
It's either going to be higher or lower than what we thought.
You mentioned something about pay increases. How does pay increase impact this?
So there's a 5% pay increase assumption built into this.
But that's only for 5%.
For 5% each and every year.
Right.
Yeah.
So
So to the extent that, let's say you have a few years where it ends up being lower than that, that would come under the gain category. So the liability is going to be a little lower, the cost is going to be a little lower. Or if you have a period of years where it's higher than 5%, that'll be a loss. So things will end up higher. But just having a pay increase is already built into this.
Right. Okay.
And that's a good question too, because I get that all the time. Well, what happens if we give a raise? Well, we're already assuming that. But if it's different than what's assumed, then yeah, it'll have an impact. So the other part of this projection on the next slide is the question that you're probably all wondering, which is, well, okay, we're going to get to 92 million. What's the cost? So we split it up into two components. Right? There's benefits, and there's trust fund contribution, and the total city contribution is just the sum of those two. So if you have a plan with zero assets, you probably don't want to start putting money in and then taking it right out. So there'll be a period of time, 10 years, 15 years, there's no right answer and there's no rule about it, but you're probably going to pay the benefits, whatever benefits we're estimating, 1 million in the first year, plus put some into the trust, and then once the trust gets to some critical mass, whatever you decide, 60%, 70% funded, then the trust will just work like a pension trust. Put money in, take money out. So that's why we split it this way, because it would be a brand new plan. But you can see the 5 million that we just showed in that pie chart, split in between the blue and the red, grows to 6.6 million, mostly because it's a percentage of payroll. So as the payroll increases, the nominal dollars increase. To think of it in today's dollars, it's roughly the same number. It's 5 million, just trended forward 20 years. And the footnote at the bottom right corner is something I said earlier, but after you reach 100% funding. So that pie chart goes from the blue and the red to just the blue. Then you can expect the cost to be about 4.2% of payroll, and whatever the payroll is in that year, because that's the ongoing benefit cost. It does vary a little bit year over year. The 4.2 could be 4 or 4.5, but it doesn't vary a lot. The thing that varies a lot is the shortfall, because you have, market downturns, you have, bull markets, all that stuff really, really affects the unfunded liability, but it doesn't affect the cost of the benefits. So that's the end of the first section for fire and emergency communications. The rest of it is the same numbers. I mean, it's different numbers, but it's the same structure. So let's look at the...
Real quick.
Oh, sorry.
Question. You did this based on 550. So how does increasing staffing impact meeting that 20-year mark?
That's a great question, and we actually, this is on one of the later slides, but we actually did it on the budgeted positions. So it's 550 plus whatever other positions are budgeted by the city.
Okay. And then you mentioned payout time as far as getting money in the bank, then paying it out. So do you recommend if say we started this next year, you wouldn't recommend paying out for what, 4 or 5 years, or?
I would say probably about a decade.
So
because
you wouldn't pay
if you
anything
think
out
about
for 10 years?
Yeah. So if you look at this slide here, after about a decade, you get into the 60% funding range, which is not bad for a brand new plan 10 years in. At that point, you must just decide, well, and again, it would be up to the city, but so we're in 2036, let's say, let's just put 5.7 million in, and let's just start paying the benefits out of the trust each and every year. That last right-hand column still applies, though.
But anyone who retired within that 10-year mark just wouldn't be eligible?
No, they would.
They just wouldn't receive a payment until...
No, one thing that's built
That's what I'm
into
trying
this
to
entire analysis is that if you adopt the plan, everyone's eligible.
Right.
You adopt the
Okay.
plan July 1st, somebody retires August 1st, they'll get the benefit, if they meet the eligibility requirements.
Right, but you said you wouldn't recommend paying out for 10 years. I'm
Paying-
confused.
and
about
what I mean is paying out of the trust.
Okay.
Yeah, and so what would happen is the city, let's just suppose these numbers were set, like we knew these for sure. So the city would have $1 million in the budget to pay out benefits, another $4 million in the budget to put into the trust.
Okay.
These are good questions. Please ask as many as we need to. So same layout for the other group, but one kind of summarizing slide here is that if you look at that 20-year projection and all the costs, there would be about $115 million paid by the city. And again, just estimates, best estimates. And you'd also pay out $67 million over the course of that same 20-year period. But the investment income expected would give you another $44 million. And that is the whole purpose of having a trust fund to fund these things. And that's how we get to the 92 at the end of the 20 years. So all of those last 6 slides or so, same information for the select operating departments. All right, so we have 5 groups in here, and as I started to point out earlier, if you compare fire versus all these groups, younger, more service. So that's why when you see the benefit costs, it's lower per person and as a percentage of payroll for this group. We did not run any of these separately, if anyone was going to ask that, but they're all lumped together. We have the ability to run anything separately. We can run in each individual if we need to. So the present value, and the numbers are very comparable. It's a larger group, you can see from those demographics, but the cost and the liability per person is just lower. So 66 million in present value if you project everyone to the end of that timeline. Less than half of it has been accrued. So on average, that population in total is less than halfway through their expected career. Normal cost, a little bit higher than the fire and emergency communications in dollars, but as a percentage of payroll, 1.8%. So a bit lower there. Yes.
And just for clarity, in the last slide, we saw 4.2% of payroll, right, as opposed to the 1.8% of payroll.
Right, and it's payroll of that group. So it's 4.2% of the fire and emergency communications payroll. This is 1.8% of that 5 operating department payroll.
Thank you.
Mm-hmm. And the pie chart looks very similar, except that the shortfall payment is actually a little bit less than the normal cost in this case. And all this stuff being a moving target, this pie chart will change year over year too. You're always working towards that red slice going away eventually, and in this case, after 20 years. So the projection looks almost exactly the same. The numbers are a little different. This fund would be projected to get 100% funded after 20 years and about $100 million in assets. The cost, starting at 4.7 million, which was that year 1 figure shown in the pie chart, growing to about 6.6 million. And it's all the same assumptions. We're assuming all the budgeted positions are filled. We're assuming everybody gets the benefit. And again, same thing applies here. After you get to 100% funding, you can expect the cost to drop down to 1.8% of payroll. So if the pie chart stays relatively stable, cost gets cut in half after the 20 years. And the totals for this group, again, the numbers are very comparable in total, but $112 million in city contributions, 62 paid out, and a $50 million investment earnings over that time frame. So 2 more slides here, and of course, any other questions, but summary is the total expected city contributions for all the groups is estimated to be $227 million over a 20-year period, and then drop down to the normal cost thereafter. So this will accumulate to 192, which of course is lower, but that's because you have 129 million in estimated benefit payments that will go out. And the initial liability for financial reporting purposes is called the total pension liability. That's the term that goes into the city's financials. That would be about 61 million. That's just the 33 plus the 27, or point something, goes to 61 million. So that's what would be recorded as a total pension liability and what they call a net pension liability because there's 0 assets. It would also be the same number as the initial shortfall, also known as the unfunded liability, and that's where the amortization payment comes from, the red part of the pie charts. So a few of these things I've already mentioned here, but everything's estimates. It's always a moving target. So the actual funding and costs would differ from what we're looking at here. Could be higher, could be lower. Any separation benefits adopted would entail additional costs and risk for the city. Maybe the estimates aren't exactly spot on, but there would be a cost. We know that. So some examples of risk: adverse experience. You expect to earn 5.5%. Maybe we have a major recession. You earn 1% for 5 years. Other adverse experience, higher pay increases. And there's also, there could be an indirect impact on other benefit programs. We didn't look into this, but just if you have a program like this that may have people retiring earlier than they otherwise would have, there could be other costs associated with that. And again, we're not familiar with the rest of the programs, but it is a possibility. So the funding and contributions are subject to fluctuations, and it's always based on actual experience. So if we assume 5.5% per year and you earn 12 over the first 10 years, the cost comes way down because that's what the cost is going to be based on, whatever actually happens, along with all the other experience. And the last point is that if you adopt the plan, there would regular actuarial evaluations be required. Every 2 years is required. I would say for a brand new plan, you'd probably want to do it every year. The financial reporting is definitely required, or would definitely be required every year in the city's financials. And I believe that's the last slide I have here. But other questions?
Go ahead.
Hi, thanks for this. Can you tell me, does the total pension liability factor into considerations like a bond rating?
Yes. And I don't know exactly. I'm not an expert on bond ratings, but yes, they do look at that. Yep.
I don't know if this question is for you. I'm wanting to reference police and law enforcement. If we are required, do we have actuals from our previous few years of separation allowance with police, or are they not required to do that same reporting that you just referenced?
That would be part of the city's financials. Yeah, it's in there somewhere. It has to be. Yeah.
So we do. So we haven't been funding that though, right? Until last year, which where we put the
Yeah. So the funding and the financial reporting are
two separate things.
Distinct.
Got it.
I mean, they're kind of related to each other. In fact, to go back to the bond ratings, again, that's not my area of expertise, but I know they will give favorable consideration if you have a plan to pay it off in a certain number of years, rather than, well, we just have this great unfunded liability and we don't know what to do about it.
Right. So if we have had it unfunded until last year and we have been being judged on that, then how has that affected our bond rating in the past, since we've been doing that for decades, the separation allowance for police?
That's not a question for me.
Yeah, good afternoon, Allison Bradshaw again from the Finance Department. Yeah, we have been regularly contributing to our law enforcement. We do have the same term, so 20 years. This was a benefit that was awarded LEOs back in the late 90s?
1987.
80s. So we do, on an annual basis, contribute what our actuaries advise us to. So we do that both on the state ledgers plan, we do that for our post-employment benefits, we also do that for our LEOSA, and we also do that in our risk management fund. So to your point, we are not a pay-go city, right? We are really taking that long-term view and making sure that we're putting aside, really that's the equitable thing to do.
So how much money is in our coffers for that separation allowance, where we should be? Where are we currently?
So if you're just on the LEO plan, we are only 14% funded right now on our LEOs. The
And that's
total
law
liability.
enforcement officials.
Yeah.
Councilmember Silver.
Yes, thank you.
Yeah, the long-term liability is almost $60 million on just our LEO plan. If you factor in all of those plans that I just described, the long-term liability to the city is $600 million.
and we are at 14% of that. So how does that I'm sorry, go ahead.
I'm sorry, that's just for Leo. So the state plan is much more funded. So that's our pension plan that we contribute to the Department of the State Treasurer, right? And we are required to do that. Last year, our long-term liability there was $215 million, and we were 82.5% funded. That contribution just in the 24 budget was $38 million, just for that one plan. When you look at our OPEB or our post-employment, our liability is almost $300 million, and we are only at 28% funded for that plan. We contributed $22 million into our OPEB, and for Leo, and again, these are 24 numbers, we contributed $7.7 million, which equates to those two columns that Greg showed earlier. That liability is almost $60 million. I'm giving you kind of round numbers, and we're only at 14%.
Got it. Thank you.
Yep. Councilor Lambert Melton.
My question's for the gentleman from BCG. I would really like to have the fire-only data. Is that something you could run through the model for us as part of this report?
Yes. Yeah.
Okay.
That's a pretty quick and easy job for us. All the data is there. We just have to split it and run it. I'm going to make a note of that.
Go ahead.
Back to Allison, sorry. I have a question for Allison.
Oh, okay.
Thanks.
Yes,
Just
Councilmember
to
Patton.
stay on these percent funding, given, so this suggests that you could fully fund your program in roughly 20 years, but then some of these benefits have obviously been in place for longer than 20 years and are funded at a lower percent. So what are the contributing factors that have these ones funded at a lower rate?
Yeah, I mean, I think a lot of it is sort of those pluses and minuses that Greg was talking about, whether they could have been dramatic increases in public safety that were outside of the actuarial estimates. It could have been opportunities where our interest on our investments didn't materialize. So the point of having one of these every year is so we're watching that goalpost, but I'll be honest, it moves every year. And that's just really the nature of an actuarial study. But we are committed and have been to make sure that we are funding it on that actuarial basis.
So I had a question, but it's actually for Charnel Jones, because this is more about from an HR perspective. You know, our law enforcement, all law enforcement have this benefit. So you have a somewhat fluid labor market without, you know, unique incentives. If Raleigh was one of the few cities, only large city in the state to have this, what sort of consequences would that have for, I mean, I'm assuming we would have a really high retention, but for example, would we ever want to hire anyone who was a seasoned senior employee because we'd be then assuming this massive liability? I'm just, you know, how would that work?
Well, it would, I'm not going to say it's necessarily will help with attracting employees because they're just getting here and have to stay for that long period of time in order to be able to receive that benefit. However, any seasoned employees that come and then choose to stay and retire, they will be eligible for that benefit unless there is some type of parameters put in place. So that would also put a strain on our benefits program.
If you adopt a program like this, can you protect against that? Like, can you protect against somebody joining and then getting the full benefit, even if they haven't?
You would have to, and I will kind of look at legal a little bit because I would have to run that by them, but we will have to put parameters in that policy as regards to when we go to implementation of the time frame an employee would have to be with us in order to be eligible for that benefit if that was the case. Mm-hmm. But if legal wants to add anything, did I interpret correctly?
Ryan Bergman, City Manager's Office. I'm not legal, but I'll try to answer that a little bit. Presumably, because this is not something that's state directed, It's totally a local initiative that would be put in. You could put parameters into it that would limit the service to Raleigh service to avoid that, but there's a number of, to limit people from coming from other jurisdictions. And so you'd say, well, it's only 2 years of Raleigh service, so that's all that counts, even if they're joining after 27 years or 28 years somewhere else. But the initial question about employees, there are, of course, employee equity issues between groups, depending on how it's implemented, which would probably be one of the concerns.
Question.
Thank you. I had Counselor Lambert Melton, and then Branch, and then Patton.
I just had a follow-up question for you, sir. I'm sorry for driving you crazy. From BCG, yes.
So musical chairs at the podium.
I know. I actually think it would be very helpful so we can fully understand the scope of this. Can you model it for each department, fire, solid waste? Because right now you have ECC and fire grouped, and then you have the other operate. I think a line for each one. How much is this just the solid waste services? How much is just fire, et cetera? If you can do that as an addendum, that would be super helpful for us, I think.
Sure.
Thank you.
I just want to be sure I'm hearing this correctly. We could set up a process where we set a minimum years of service, say 10 years with the city of Raleigh before you're eligible. Okay.
I think the attorney should be speaking to this, to be honest.
I'm putting it out for
I appreciate you, Ryan, but I think the attorney should opine on this issue. And I think because it's the city of Raleigh benefit, we have the ability to structure it, but that should be a legal decision, not my office.
What Ryan said is correct, but I think that, again, we have to be careful to make sure that we don't run afoul of any other discriminatory practices in crafting that.
Okay, let's see, and Counselor Patton.
Might be for HR. I want to confirm my understanding. So one thing that came up in consideration of this last year was that law enforcement has to have a 4-year degree, which sort of by design makes them a little bit older when they begin their career. Is it true that in fire you do not have to have a 4-year degree and that you could start your career at the age of 18?
That is correct.
Okay.
I think it's 19, 19.
19. And did it used to be true that it was 21?
Yes.
Okay.
We reduced it.
So I think I would be interested in how we might, as also there are policy considerations for like years in Raleigh to contribute to the benefit. I would also be interested in how we could craft like if this is paired with raising the minimum age of beginning your career. I think that contributes to lowering this cost as well. That's more of a comment.
Yeah, go ahead.
Awesome. This is for Allison. Allison, I'm just clarifying in my brain, trying to make this all make sense with the what we contributed to law enforcement. So when I looked at it, you said 7.7 million. Now that's in addition to the 5 million that we did pay out last year to law enforcement. How much in 2023 did we do? We paid out, and how much did we put aside? If we put aside 7.7 million last year, how much did we put aside in 2023?
I do not have the 23 numbers in front of me, but very similar to this slide, where you can see that total city contribution is pretty similar here. That's really how our LEOs have been as well. So 7.5, 7.6. It's not like it goes from 2 to 7, right? The design here is to really fund that over the long term and not create those budget spikes. I don't have what was paid out of the.
But in theory, what you're saying, even though we don't have the specific numbers, is if we did 7.7 million last year, then roughly in 2023, we did somewhere around that.
Correct.
So in this fund, every year it's going up because just like this chart is going up, but last year was 7, so we're thinking it's roughly the same year before.
Somewhere around that. I could get you the exact, but yes,
Yeah.
Again, very, very similar to this.
Yeah, I would appreciate seeing that. Thank you so much.
Sure.
You have a question?
I do. And I think just, sitting here and kind of listening to the conversation, one of the concerns, I have is that the inequities that could potentially be created within the fire department, but also the inequities that could be created across the entire organization for the city of Raleigh. If you start putting limitations on who can receive it and those types of things, can you, I guess as a city attorney or Charnel or somebody, speak to the risk that we run as a city from that perspective?
I do think there is a potential for disparities, and it's difficult probably to quantify all of the disparities or potential disparities right here at this table. But one of the things that immediately comes to mind for me, and I think Mayor or someone touched on this, which is you have the potential to discourage experienced firefighters, if we're just talking about firefighters, potentially discouraging experienced firefighters from coming to the organization because you create an inequity. You have a 20-year veteran, say, from another department who may not be inclined to come here because they would not be eligible for the benefit that someone who has been here for 20 years would be eligible to receive. That's just one example that comes quickly to mind, but I'm sure that there are others if we were to have some more time to think about this.
I have some questions for the fire chief. I'll start as you're walking down, Chief. As we talk about numbers, I'd love to hear, especially in our recruitment, our turnover rate and what other possibilities that, if this is just one idea that we're talking about for recruitment and for retention, what are, in your expertise, some other examples? If this is something that we don't go with, what are some other strategies that we can use to both retain and recruit? So I'll reframe that question, I'm sorry, because I was giving you some background as you got down here. Just taking the last firefighter, the last maybe 2 academies, how many did we start with and how many graduated?
Good afternoon, Mayor Kyle, Council, Ms. City Manager, Herbert Griffin, the Fire Chief and Director of Emergency Management. The last class we had in 23, we had 45 start, 23 graduated. This year we had 41 start roughly a month ago, 5 have already quit.
5 have already quit?
The first week, yes, ma'am.
The first
Due
week.
to unforeseen circumstances, yes.
Do you feel, not that they would solve this, but do you feel that separation allowance would be a retention factor for those coming on?
Absolutely. It's a measure, it's an incentive as for recruiting and retention, yes.
And if we don't have that, what other tools do we have to recruit that we are not currently enabling?
We have one recruiter and a team at our professional development that does recruiting inside of Raleigh and outside of Raleigh. Social media is our biggest tool right now when it comes to recruiting right now. But retention is an issue. Roughly at every class the last 3 years, we lose roughly up to 12% of those academy classes. And
So
that's
in
due
this,
to,
I'm sorry, go ahead, I'm so
yeah,
sorry.
that's due to the actual inability to pass the EMT portion.
The EMT portion. So if I relate this and I translate, so the graphs that we've seen, we may hire a certain amount, but immediately when we leave, we technically benefit from the fact that we're contributing for those slots that then are not here because they quit.
That's correct.
Okay, thank you.
Madam Mayor, while you're here, I have a couple questions myself. Would you say amongst your employees, what's the highest priority, current pay and salary or separation pay?
That's a tough question. I don't speak on behalf of everybody. In my 29 years, starting out, I would say compensation. Once I hit the 15-year mark, it's separation allowance. Because I'm looking to the back end of my career now, not the front end.
So when you're talking about
the
recruit,
gentleman said, I want to highlight this. He said about he don't expect anyone to pass away. I've been here 4 years and had 5 firefighters die already under my command in the first 3 years. So that number, firefighters have a 22% increased chance of catching cancer and dying at an early age. The active expected lifespan for a firefighter 10 years ago is 59.2 years. That's facts. I wrote a white paper on it.
Okay. My other question is, what's the average age of, what's the average year that folks end up leaving the department? Like if they start year one, how long do they typically stay before they leave?
Average age is about 55,
No, in terms of years of service.
30.
So most of your people come in and they stay until 30 years?
Yes, ma'am.
Okay, thank you.
I think what her question is, Chief, before you step away, if we had to have a tension point, if you had to signify at what point we're having issues with retention, how many years of service? There's a span for police. What is the span for fire? Number of years?
Retention,
Yeah,
3 to 5.
3 to 5.
Yeah.
Police, it tends to be 5, 7.
Yep.
Yeah.
Thank you.
Okay, any other questions for any of the revolving experts in the room? All right, well, we have.
I'm sorry, I do. And this may be finance or budget. My understanding is that currently we pay out of the general fund in order to cover the LEO and everything for police. Is that correct?
That is correct, yes.
So this money would also come out of there if we were to do it. And starting out, it would be roughly about 7 million?
The number that was shared was 5.7, I think. Oh,
But that was for
sorry, 5.
fire and EMT.
Yeah,
And then
but-
you have everybody else, so I'm grouping everybody together.
Yeah, so fire and ECC, that first 5 million you see there is 100% general fund. The other departments, I mean, Raleigh Water is an enterprise, Solid Waste Service is an enterprise, Parks is general fund, Transportation and Engineering Services are all general fund.
Okay.
So since we don't have those separated, it would be some number of this 4.7
I
that would be
split that in
general
half
fund.
and
Yeah.
say 7, if you add
Sure.
the two together,
Yes.
roughly.
Yes.
Oh, I got Ryan.
One distinction I want to make sure that we're clear on is this was prepared based on a council request last year for specific operating departments, but it doesn't represent all employees in the city that you might consider to be operations. So adding solid waste and parks and a couple of the others would leave out some of the other departments, thinking of code inspectors in housing or civilians in police and fire. So if it was citywide, it would actually be even more significant than the two presented here.
That's a very good point, Mr. Bergman, because when the budget note was requested last year, I think, can't remember who made the request, but it was for fire and ECC. And then Mayor Pro Tem Ford asked for the other operating departments because we were having some issues with attrition in solid waste services. And at that time, we were not as advanced into the comp study to know what the other classifications across all of our departments. So the data that was presented today is the data that spoke to that specific budget note that you all asked for. It does not, it's not an all-inclusive. So those numbers would be slightly larger on the employee count.
I think Counselor Jones and then Silver.
Okay. I have 2 questions. The first one, I'm going to say, I don't know who, but I know we did a safety collaborative, and I was wondering if somebody could come up and speak to the discussion. Did we have a discussion of separation allowance there, and how did that go? How did the employees feel?
So it was Public Safety Collaborative. Charnel Jones can come speak. Tansy Hayward, the deputy city manager at the time, also worked with fire during that time period. And my office, Evan Raleigh and myself went to a couple meetings when they originally kicked it off. It was a refresh of what we used to have, the Employee Advisory Group, the EAG. We classified this one as the Public Safety Collaborative.
And so, yes, this past fall, we did have a meeting in regards to the public safety collaborative discussing the separation allowance. Budget came and did a workshop, and we kind of talked about the other municipalities that do offer it. And we talked about a budget note from that perspective and coming back with that as regards to the budget.
So were they in favor of separation allowance?
There were some that were not. They said that, they would be more in favor of pay versus separation allowance, that it didn't necessarily speak, but I'm not going to say all of them agreed and said that pay was number one, but there were some that did.
How many people were involved in that?
In The meeting, or in the Public Safety Collaborative?
The collaborative, yeah.
We have 4 from fire, we have 4 from police, and we also have 4 from emergency communications.
Okay, so about 12 people. Awesome. Okay, thank you so much.
Okay. Counselor Silva?
I have a question. I don't know who to direct it to. I know this actuarial was focused specifically on Raleigh, but, you know, I am aware there were other jurisdictions in North Carolina that put this in place for fire, put it in place for all employees. Are there any lessons learned from those jurisdictions? Don't know how long they've been in place. I don't know where they are in the 20-year spectrum, but it'd be very helpful to know any trade-offs from those municipalities that actually put that in place. I don't know who, Ryan, I don't know who could answer that question, but I'd be
That kind of
curious.
predates Ryan a little bit. Ryan, you can
Okay.
add on if you want. Last year, council will remember that we did a comparison in one of the managers' briefings, and the 3 municipalities that were included that were providing that service at that point, the separation allowance, Raleigh outnumbered all of them combined. So the total debt liability on our books exceeded all 3 of those communities because they're much smaller communities. They looked at the tax rate of each one of those municipalities. We looked at the total general fund. So to put it in perspective for you, one was 86 million, one was 70 million, and one was 33 million, all combined. That was their whole budget. So for all 3 of them, you're looking at 156, roughly $190 million, and our general fund budget is almost 4 times that, just on the operating side alone. So it was, in comparison, because we received some correspondence from, I think, the mayor of Mebane, and we did an analysis not just on what it would be for Raleigh, but every community that currently has the benefit right now. I think it was Gastonia, Mebane, can't remember the other one, but the outlay for us far exceeded all of those combined, right?
Yeah, I would just add that there's not a good
We'll share
North
this.
Carolina comparison for anyone that's done it. In fact, going a step further, the organizations that we typically compare ourselves to, we call the Big Ten, the 5 big counties, the 5 big cities. There's actually been movement over the last 10 to 15 years from several of them to eliminate retiree health care for new employees. So they're actually talking about eliminating future other post-employment benefits, whereas we've luckily in Raleigh been able to maintain them. Any other? Yeah.
I just wanted to make a comment, not a question, so Counselor Patton, if you have a question. Okay. Yeah, oh, thank you so much. Yeah, for me, I just want to put on here, I think there's still a lot to talk about. We've been talking about this for a few years now, and I don't know that I'm still 100% clear on the information. There's a lot of numbers that are going back and forth, so I look forward. I really do, Ms. Bradshaw, would love to have further conversations about our CAFRS report and how that all, especially comparative to law enforcement, because that's where I'm stuck. I'm stuck because when I'm looking and I don't know what I'm looking at, so I definitely need your guidance. How do I make that make sense? Because to me, I thought that I saw, and I could be totally wrong, that we started doing the additional funding, that $7.7 million last year. But if not, I can't wait to see where that was so I can correct my own understanding of it. As I've been talking, and I'm sure all of us have, public safety in general is a huge concern for the community. And as we look at our numbers, which we've seen both in police and fire, our numbers are not great. They're not where they should be for the capital city or for a city that's continually growing and hasn't added positions in 10 years. It concerns me that we have the fire chief come up here and say, we're losing 50% of our recruits before they even get on the job. And so if this isn't the answer, then I'd really love to learn what other tools we can do. And I'm not saying this is then we're all going to keep everybody at the same time, but I feel like we need to signal to the community that we hear them and that we are putting public safety as a really big priority, because that's how I see my job. My job, first and foremost, is to make sure the community's safe. I hear the equity concerns completely. I hear you. I will say and challenge that our public safety are putting their lives on the line. We're putting a lot of, especially fire, they're after retirement coming with cancer and things, and how are we making sure that this is a commitment to them? So for me, this is a really big thing that I would love to see included in the budget, but I would love to hear other thoughts and how we move forward, because I don't want to leave this without some direction.
Chief, can you come down? I have one question for you. And it came from me off of Councilwoman Jones' comment about the retention rate, losing that 50%. Can you speak to the causes of losing those recruits? Like, why are we losing half?
The 23 class, like I said, we lost 23 people. That was a combination of changing occupations, career moves, education. They couldn't pass the actual requirements of the education. That's the majority of it. Every exit interview that comes across, I read them. The top three were career change, compensation, and burnout on the industry. Those were the top three reasons we see the exit interviews. Burnout, occupational burnout.
So career change, burnout, and you say compensation from what standpoint? Money or is it benefits?
Low pay.
Low pay?
Yes.
Okay, that's helpful, thank you.
Well, I mean, I'll just make a couple observations, which is I really do appreciate all the work that went into this when we were all running for office. One of the things I said is, let's do an actuarial study because I'm not going to be the ex-treasurer and not know the numbers. And I think, you know, what we've seen today is between 40 and 50 million a year shortfall on comp to get us somewhere. And then, you know, one question I have is just, I think, you know, Councilor Jones, your question around, is it comp or is it retirement? You know, who are we recruiting? If it's younger people, it sounds like it may be more comp. More seasoned people are going to be thinking more about retirement. So what is the age at which we're recruiting in is an important question to understand what the best retention tool would be, because we know our comp's not great. And then I would also, I mean, I was just at the police academy graduation and they had started their academy at 69 and are down to 40. They have separation allowance. So they also are having a lot of retention issues despite having this. So as you say, there's a lot to sort of mull over, but I do appreciate all the information and certainly just thinking about how would we fund, you know, these numbers.
Yeah, I just wanted to add that, you know, I also hear the equity concerns. You know, I think we have to think about what each individual department or employees may need. And so we do know that the police department is already provided this benefit through the state of North Carolina. And we know that police officers are putting their lives on the line every day. We've heard from the chief, and I knew some of this information too, that our firefighters have higher rates of cancer, lower life expectancy. And so a bridge to retirement for them makes sense to me. I also hear the concerns for like a highly physical job like solid waste services. So I think there's, you know, those folks are out there, also very dangerous occupation, also very physically challenging. And so I think there's different needs for each department. I think having the data, instead of like ECC and fire and then all that, I think having line items would be helpful for us to be having the information that we would need, and then figuring out what benefits are going to work for recruitment and retention, what is fair, what do each department and employees need, and then we go from there. And so I think that that's where I'd like to see the discussion go.
Any other? All right. Well, thank you, everybody, for presenting, all of y'all for coming, and that concludes today's work session, and we are adjourned.